Connecting Arizona. Live from the 12 News studios at 200 East Van Buren. This is 12 News Today. Saving you $1 million and counting. This is Call 12 for Action.
Welcome back, everybody. I'm Call 12 for Action's Dave Cherry. Nowadays, medical professionals like cosmetic surgeons, dermatologists, and even dentists are using patient photos for marketing purposes. This is fairly common, but what if you don't want your doctor using photos of you? Dr. Daniel Shapiro is a Scottsdale plastic surgeon. He's here to help patients understand what their privacy rights are. Dr. Shapiro, thanks for coming in this morning.
You're welcome.
Good to have you here with us. First of all, HIPAA, we know a lot of people hear that term. That's kind of the laws governing patient rights. What do they say about photos? It's okay with them, right?
Yeah, basically they mandate that for photographs to be used on the internet, on a website, that basically a plastic surgeon or a doctor would have to have a specific consent form for the website. That they would have to encrypt the photos, which means that people wouldn't be able to see the identity or the patient's name.
Okay.
And also we have to have an ongoing system of monitoring the quality of the photographs.
Well, we were talking in the break that it shouldn't really be happening too often, but every now and then it does. What if a doctor's office is using unauthorized photos of you where you really haven't given your rights to do that? What do you do in that case?
That's a pretty big deal. Basically, you can call the office and ask to have them taken down, and I can't imagine that somebody wouldn't have them taken down. But I think that as a safeguard, I would put that in writing. I would actually formally write a letter that you document and send it to the doctor or whoever it is to have them taken down.
So let's go to the other side where you have given your permission, you have given them the consent to do it. A lot of times people really like their photographs at first, and that's why they do it. But let's say they kind of get a change of heart and they don't want them on there anymore. What is the doctor required to do, and what are my rights in that case if I want those photos taken down off their website?
Well, I mean, we're in the, we want people to be happy, so I can't imagine someone not taking down the photos if they're asked. But again, I think that I would put that in writing, send a letter, and I think I'd be sure, when you have your photographs taken, ask to have a copy of those photographs emailed to you, and make sure that there's not things like jewelry that would identify you or tattoos. I mean, those are pretty common now.
And we were showing some video there a moment ago of another surgeon here in town who did use pictures appropriately. They were very nice photographs too, and that's what happens. A lot of times people like them at first and then they want them taken down. But what you're saying is you do have a right to have them taken down once you do that.
Absolutely.
All right. And then that release form that you talked about, getting something in writing, what should you look for on that form as far as language goes to know that your rights are being maintained here?
There are different reasons why we use the photographs. The first one would be for documentation before and after, or if we need an image. So those photographs are confidential, and I think I would look for that and ask that they be confidential. The other category is if we use them for to show patients or magazines or journals or teaching, that would be not confidential, but that wouldn't be a website. And then lastly, there's a specific language that specifies website usage. So there are three different categories, and I would just make sure that you understand what's going on.
So that's what you want to look for when you're looking at that release form. And if you want more information, you can go to our website, 12news.azcentral.com/consumer, and I've put a link to your website there where you've got more information about that. Thanks so much for coming in this morning. I think this is great information for patients' rights. And don't forget about our Shred-a-thon. It's coming up on November the 7th, and I'm going to have a lot more details about that next week. Celeste, over to you.